So in this video, we'll learn about corneal examination. What are the important aspects that you have to look for in corneal examination, and what would be the most common questions that you would encounter. Okay, there are five components that you would examine in a cornea: size, shape, surface, sheen, and sensations. So 5S, please remember it as 5S. Okay, we'll go into each one. Size. The normal size of the cornea, you need to know it. Okay, the normal size of the cornea is slightly elliptical. Vertical diameter is around 11 millimeter and horizontal diameter is 11.7. So vertically it is a little smaller than the horizontal diameter. What are the abnormal sizes? You can see microcornea. When do you call it microcornea? When the horizontal diameter is less than 10 millimeter. Please remember this. If it is less than 10 millimeter, we call it as microcornea. Megalocornea, when the horizontal diameter is more than 13 millimeter. Okay. The shape of the cornea. The normal shape, cornea is described as a watch glass. The central 3 millimeter is spherical. It's actually a aspheric structure. Central, it is spherical, and as you go to the periphery, it becomes more flatter. Okay, but you to examine the shape of the cornea, you need specialized instruments like placidus disc, keratometer, corneal topography, or pentacam. Normal corneal curvature is around 42 to 45 diopters. Okay. So on torchlight, it is difficult to comment on the normal shape of the cornea until it is grossly abnormal. So what are the abnormal shapes? You can see keratoconus where the cornea is conical in shape. So if you see, this is a normal cornea, whereas here the cornea has become conical in shape. On torchlight, how will you see? If you ask the patient to look down, the lower lid will take a V-shaped sign. This is called as a Munson sign. In a normal corneal shape, this will not be seen. Keratoglobus, where the cornea is globe-like protrusion of the cornea. This is a globe-like protrusion of it is not V, but it's more like a globe-like protrusion of the cornea. And so this is the placidus image where you'll see that the corneal inferior corneal surface, the shape is also distorted along with the surface. Now coming to the surface of the cornea. The normal corneal surface is smooth. Okay. So if it is distorted, you will have to comment about it. But how will you make out on torchlight? So where will it be distorted in corneal abrasions, ulcers, or scars? It can be distorted. How will you make out in torchlight? Well, if you have a placidus disc, you can use it. This is how a placidus disc, which has a central convex mirror, and it has black and white circles. So if the examiner sees through this convex lens, he can see the images formed on the cornea of the patient. So this is how a normal cornea, if the surface is smooth, you'll see that the circles are well distributed and the lines of the circles are well defined. Whereas an irregular cornea, this is the shape. If the shape of the cornea is abnormal, then you'll see the circle, instead of being circles, they look elongated and they're flatter in one meridian and they're wider in the other meridian. Whereas the surface is abnormal, you'll see that the lines appear distorted. So placidus disc can be used for both identify the shape of the cornea and also the irregular surface. If you don't have placidus disc, how will you examine? If you're examining on the exam, how will you say this surface is normal? You can do something called as window reflex test. So you will take the person to the window. So this will also act as black and white images falling on the cornea. So if you see the image of this grill on the cornea, and if you see that the lines are straight, then you can say that this surface is smooth. If the lines are distorted, then you can say that the surface is irregular. Then coming to sheen. Well, sheen is either you say sheen present or absent. The normal cornea is a bright shining structure. It has a sheen. So dry cornea lacks the luster, and you describe it as a dry lusterless cornea or corneal sheen absent. So this is a normal cornea, and this is how a dry cornea looks. So if you see the shiny surface is lacking here, and this is how you'll describe in a dry cornea, and it's seen in dry eyes, white vitamin A deficiency, chemical injuries, and Steven-Johnson syndrome. You can see loss of sheen of the cornea. Now, the sensations. So this is how you check the sensations. you check from the sides using a wisp of cotton. Okay. So normal cornea is a highly sensitive structure being richly supplied by nerves. So you will check with a wisp of cotton. You will check in all the uh, five areas: superior, temporal, inferior, and nasal, and also in the center. And you will demonstrate it like whether it's present in all the five areas. Okay. Corneals. You can also check with a esthesiometer, which is also called as a Cockett-Bonnet esthesiometer, which is a more objective way of checking the sensations of the cornea. Corneal sensations are reduced in case of viral infections like herpes simplex and herpes zoster, neurotrophic keratitis, leprosy, and diabetes mellitus. So you will have to carry a wisp of cotton for the exam and check the corneal sensations. We will play this again, bringing the wisp of cotton from the side and not touching and look for the blink once you touch, so if the person blinks. Okay. Transparency. Normal cornea is a clear transparent structure. We all know that. Whereas the corneal transparency loss is lost in corneal edema, corneal opacities, dystrophies, degenerations, and any corneal vascularization. So you have to, if you are asked what are the conditions, name the conditions where the corneal transparency is lost, you can tell all these conditions. Now, most of us will see something. I mean, if you're examining old patients in your clinics, in your exams, you will see this. Okay, you will see this kind of discoloration of the cornea. This is called as arcus senilis, which is very common in old age. Okay, you will describe, so you will, when you describe cornea, you will say the size, normal, shape, normal, surface, normal sensations, normal and sheen present. And then you will also describe, when you're describing transparency, in young adults, this degeneration will not be there. You will describe it as a 1 millimeter whitish discoloration involving the peripheral 360-degree circumferential cornea, suggestive of arcus senilis. You will not say in your description arcus senilis present. You will describe the condition and then you say suggestive of arcus senilis. Okay. In summary, what all you look for in cornea, you look for five things plus the transparency: size, shape, surface, sheen, sensations, and transparency. If all are normal, you will describe it as normal. Okay. You will again, I keep reiterating, don't say no megalocornea, no microcornea, no keratoconus. You just describe. You will look for the size. You will carry a transparent scale and measure. If not, and then and say that this is appears normal, size appears normal, shape appears normal on torchlight examination, surface on window reflex test is normal, sheen is present, and corneal sensations intact, and cornea, and I see a transparent corneal structure. Or if you see arcus senilis, you describe it as a 1 millimeter wide discolorations on the involving the 360-degree circumferential cornea at the limbus, suggestive of arcus senilis. And you end the corneal examination. Thank you.